Hello, hello, hello. Good afternoon. We are excited to be again together in an installment of Purveus Help's efforts to prevent social and health disparities. And we have a group of ladies here today who work in supportive services. And I'm super excited because they will be sharing some information from a population that we don't often get to hear the voice of, from populations that we don't actually get to hear the voices of. This particular installment today is called Vaccinating the Vulnerable, a conversation with African American female supportive services. And so I'm really, really excited to be here. And I will start with just having our attendees briefly introduce themselves and maybe say the demographics that they actually spend time giving support to. And so on my screen, Lakecia Lovett is with us first, and she is the CEO of Encompass Solutions. So Lakecia, welcome.
Hello everyone, and thank you again for having me. I am so grateful to Purveya Health for these opportunities to give voices to individuals who wouldn't normally have a chance. So I am the CEO of Encompass Solutions, and we are a community-based organization that provides a safe place for expecting mothers and their families who are at higher risk for poor pregnancy and childbirth outcomes. So we work with the families to provide prenatal care services. We also provide the child care coordination services. We're adding doula services now to what we do as well. In addition to, we have a background in mental health areas. So being able to identify some factors and kind of gauge and navigate families to other supportive services in the community. So thank you again for having me.
You're welcome. Excellent. Very great. Thank you so very much. And next on my screen is Miss Crystal. Crystal, would you mind introducing yourself, please?
Hello, everybody. My name is Crystal Ayad, and I am the lead advocate with the ASHA Project. I am primarily working with Black women, particularly in the Washington Park neighborhood of Milwaukee, but all over Milwaukee and Wisconsin. And we're often working with these women who have suffered domestic abuse, sexual abuse, elder abuse, and human sex trafficking. So that's what I do.
That's excellent. Thank you so much. And thank you for being here and for your service. All righty. And next on my screen is Antonia Van. Miss Antonia, would you mind introducing yourself, and then we'll get Dr. McManus at the end.
Okay, thank you. I'm so thankful to be here to have this opportunity to talk about this important issue. My name is Antonia Drew Van, now known as Norton. I am the founder and director of the ASHA Project, now a part of End Domestic Abuse Wisconsin. ASHA began as ASHA Family Services in Milwaukee in 1987. It is a culturally specific domestic violence and intimate partner violence program that is designed by and for African-American women survivors and their family. ASHA provides an array of services that include case management, crisis intervention, safety planning, lethality assessment. As now we have a new project that is just taking off because we are a recent awardee of a HUD grant to be able to provide transitional housing and rapid rehousing, which is a critical issue for this population, particularly because of the impact of COVID within these communities. ASHA continues to serve primarily survivors of domestic and intimate partner violence, sexual assault, and sex trafficking. All of these have been exacerbated by the impact of COVID-19 within the Black community. Annually, our client base is 68% African-American, 23% white, and 9% from communities of color. And 90% of our clients, which is typically 475 annually, 90% of these individuals come from communities that are disproportionately impacted by a number of things. And in particular, issues such as infant mortality, which Milwaukee's Black community is typically number one, number two, or number three in the country. And I know Dr. McManus could add to that. This community is also impacted by poverty, unemployment, disinvestment, and structural racism and oppression. A typical client is a 32-year-old female with 3 children under the age of 12 and is impacted physically, emotionally, and psychologically by domestic and intimate partner violence by a partner who is also an African-American male in the same age range. We have new services where we've always served older adults. However, we formally have a grant that addresses safety issues with older African-Americans in the community.
Wow. So impressed with just the breadth of your services and the intentional focus on the people groups with an understanding of the specific issues that impact them. And so thank you so much for that. You're giving us a ton of information that answers many other questions. So I'm going to shift to Dr. McManus, and then we'll go come back around with some of the questions that'll get some more of that information. So thank you so very much. Dr. Patricia McManus is not able to be seen on the screen by now, but we can hear her voice. So Dr. McManus, would you mind introducing yourself?
Well, thank you. My name is Patricia McManus, born and raised in Milwaukee. Haven't lived anyplace else. There's probably some of my dysfunction, but it's okay. It helps me figure out what I got to do. I just went and voted this morning and saw so many people in there. I'm like, I got a mask on, guys. No, we hear your voice. We know who you are. You can just forget that. So I gave up a long time ago trying to hide. But what I've done, and I feel what I've been called to do, is to advocate and to educate. And if I talk mostly about what the Black Health Coalition does, that's what we do. The populations, and I know that's one of the questions, but we primarily work with women of childbearing age, and then we also work with African-American males. We've done that for the last, the coalition itself is like celebrating 33 years of being around. And so we work very closely with Black males and African-American females, but we also, we have grants to do things for other groups and populations. We do that as well. When all the information came out about the new health, and this is back when Obama, who's in Milwaukee today, as a matter of fact, but health care going on, they didn't, for some reason, the state didn't have large places where they sent people or just had people refer. And so we were one. We got a federal grant to provide those services. And it was, again, you learn, I see, while you're teaching people, you learn yourself. If you're open to that, you kind of, it's clear that you don't know everything. And I think that's, so we've always, we work with a woman on the South Side when it comes to working with, the other thing we work on is child welfare. I have a great concern about the number of Hispanic children and Black children who are taken needlessly, and that is continuing, and it's even getting worse in terms of how we do it. So for the vaccine, what's going on with COVID, I know the first thing I did when I heard about it, I used to try to keep up with all the things that are going on, and started looking at, across the country, countries were already talking about COVID and looking at large numbers of domestic violence, alcoholism, all those things that we see now in the United States was in the other countries have gone through. Trying to get now for us to have our people, especially we got Wisconsin, but then you got Milwaukee, and then there's a whole different way people look at the needs of Milwaukee. And if you have people who live in areas like that all the time, it's important that they feel that they're important. What we did for the coalition, for the COVID was create a Black immunization coalition. So in which we invited grassroots people, but we also invited MDs, doctors, we invited other people to be part of that so folks could get together and talk about what they think is important and is needed in the community. And so we've had it like 2.5 years, and and actually we're even when we're not funded anymore, we're gonna keep doing it because it really has helped a lot of the people in our community understand what this is and get their opinions about. We got their opinions about vaccines and didn't tell them, well, you're wrong for doing it. I see people doing that
Right.
cringe sometimes, because
Mhm.
you can't do that and expect people to trust what you say. You
Sure,
acknowledge what they say, and then you
sure.
talk about other things. And so we've had it, like I said, about 2.5 years now, and really have gotten good feedback from them and questions they'll ask. And again, what we do, and I do that in all our services. So child welfare here has gotten me very concerned right now.
Mhm.
And so I'm dealing with that. I already got some kids returned home already this year that should never have been taken in the first place.
Mhm.
And
Mhm.
I think that, that's important. So I clump it into, like I said, education and advocacy, but we actually just do whatever we need to do to make sure that the people we're working at are comfortable, and that also that they learn so that it's not putting them someplace where they got to call us back all the time, because we have very bright people in our community who don't get credit
Sure.
for it because they don't have a PhD or they don't have something like that.
Right.
And we that doesn't tell you. I very shortly, and I'll get off. I tell you about this one woman who she had 6 kids and just made a mistake, ran out to the store, got back and forgot and didn't realize she didn't have her key. So the first thing she did was call the police because she's worried about her kids. She had 6 kids, and they're all asleep, doing well, but because even the police told her that they really wish she hadn't called them because they had to report it.
Right.
So they took her kids, but the long story short, we got her kids back. And then 2 years later, I'm out of children's court helping folks, and I saw her, and my face must have said, "Oh my God, did they take your kids again?" Because she just came up to me and said, "No, Dr. McManus." Before I even said anything to her, she said, "No, Dr. McManus, I still have my kids. I'm out here helping 2 other moms." Now,
Wow.
that's
Wow.
what you want,
That's
right?
Yeah, absolutely. And that's
So
a
that's
fantastic segue into kind of just the real specifically different supportive services that the African American community needs. So thank you so much for sharing that story. And thank you all for your service. I wanted to just zero in on one thing that you said, Dr. McManus, and I think that this is a caveat that can't be lost. And it is that in providing supportive services, in particular for marginalized people groups, the folks that are the workers, they do whatever they need to do to give them the support that they need to be able to function well and to get to the other side. And so I'm grateful for you all kind of sharing little snippets of the story of your work. And I want to just shift to the questions that we had prepared, because we do have just a small amount of time and we want to get through several of these different things. And then at the end, if we have some time to kind of talk more about just some general things, I want to make sure that we are able to do that. And so in keeping with the line of questions, I want to just say that this particular recording really is telling a story of the vaccination experience of African Americans in urban and rural areas in Wisconsin. So we do have a focus and an emphasis on Wisconsin. It happens to be in the Milwaukee area. Most of the folks are in the Milwaukee area. And we know that the demographics are consistent with the numbers that were actually the most alarming, and the reason that the granting agencies provided the kind of support through this grant that they did. In any case, it's our hope that we'll tell a story that will have people who get to listen to this when it's broadcast learn more about an honorable way to engage with the entire African American community, whether they're vaccinated or unvaccinated. Funding from this workshop was provided by the Wisconsin Department of Health and Human Services. So thank you all again. for being present. Thank you for just your service to the community. I know that it is a labor of love. And I know that when I worked in homeless shelters, I told people that it should have been counted in dog years, because it's really like you live 1 year of supportive services is something, that you actually can't describe for people that have buttoned up kind of existences in their jobs, because we know how people are showing up with all of these other intersections of poverty or discrimination that they're experiencing, and then the stress levels and all of that other stuff. Any case, I'm going to shift to our questions. And one of the questions starts by talking about some work from Sheila Walsh. And Sheila Walsh was actually an evangelist who was working on a Christian-based broadcast, and she felt like she had just had it and she couldn't function anymore. And she had been telling people this for a little while, and they were telling her, "Don't leave, don't tell anybody, you can do it. Just muster up the courage to just keep going." And one day, she basically, in the middle of a broadcast, walked off set and checked herself into a mental institution. And the thing that she did was she wrote about those experiences in books, talking about how she recognized that the shame and the stigma and all of those things almost made her lose her mind. And so in one of her books, she wrote, and I say this a lot, she said that sometimes God gives you gifts that make your hands bleed when you open them. Mm-hmm. And as providers to these communities that have been disenfranchised and that have just a ton of other maladies that they are every single day having to cope with and trying to recover from, sometimes domestic abuse, sometimes low birth weight, or whatever the issue, the trauma is, we need to care differently for them. And so during the pandemic, when access to resources were even more restricted and fear about going to get the resources was heightened, it told a different story to the populations we were trying to serve. And so could you guys just maybe, even if you have some statistics or things like that, tell us what the populations you were serving were saying about whether they wanted to get vaccinated or didn't want to get vaccinated? Lakecia, would you start us off, please?
Absolutely. So the population that I directly serve, and indirectly their family members, are women that are expecting, all ages, high risk individuals. So it's going to be more than likely people of color. So you take a woman who already has potentially and more than likely a diagnosis, a health diagnosis. So it could be preeclampsia, hypertension, diabetes, or gestational diabetes, or just high levels of anxiety. And now you tell them, we need you to get this vaccination. And we can't tell you the side effects because there isn't enough research yet to let you know what the side effects is going to be on you and your unborn child. So a lot of the clients that I encountered were like, absolutely not. I have enough going on in my world today. No, thank you. So that was what we were met with initially. The focus then had to be, well, let's meet their immediate need. So that list can be up to 50 different things per one client that can be an immediate need. Housing, that was mentioned earlier as the introductions were going forth. It could also be food disparities, right? They could be living in a food desert. They could be living in a health desert. Are they getting back and forth to their appointments? Do they know what to even talk about when they get into the room with their physicians? Are they comfortable having conversations with their physician? Is it a team, or is it one person that they are going to see? So let's meet the immediate need was really our focus and what was driving us so much in the pandemic. And now, and as the numbers begin to decrease, we could have more conversations about the vaccinations. But more individuals were seeing a lot of the breakthrough infections from, okay, this person has the vaccination, but they still caught it, or they still ended up in the hospital. So it was definitely it was a hard task for us with the women that were pregnant. Some of them did decide to get it. They said, I'm just going to take this risk because I don't want to, take the chance of getting it and I die as well as my baby. But the majority, it was after. It was, we could really have a more focused conversation on that after they had delivered the baby.
Okay, thank you for that, Lakeisha. Thank you so much. Crystal, can you tell us a little bit about some of what you were hearing from the clients that you all serve at Asha House?
Yes, ma'am. So the majority, I would say, honestly, out of all of the people, women that I've served, especially at the beginning of the pandemic, every single one, with the exception of one, said absolutely not. I'm not getting that vaccine. And it's not because, one of the things that I noticed is that when it was marketed to Black people, because we were suffering with COVID severely, but when it was marketed to Black people, it was marketed in a way that really was insulting to our intelligence. Like they may as well have said, you're dumb if you don't get it. Right. And they acted as if we weren't making informed decisions. And one thing I never did, because number one, I'm not a healthcare provider. But one thing I never did was tell my clients what they should do. I never said, well, you should get it. Because here's the thing, I would never recommend anyone to do something that I'm not even comfortable with. I made it the informed decision not to get the vaccine, not because I'm uneducated, because I saw all the information, because really, especially like with the breakthrough infections that were happening, and the other thing that was happening in the beginning, especially, is that well-known Black people in the community who were getting the vaccine and getting on TV and saying, yay, I got the vaccine. One of the things that was happening that a lot of my clients even talked about in the beginning of the pandemic was they took the vaccine, now they're dead. And of course, the CDC, said, no, it's unrelated. It's unrelated. And I forget the brother's name, but he was a baseball player. He was a lot older. And so they were saying, no, he was just old. He died of something else. And, but you tell that to an already distrustful population, an already vulnerable population, instead of just being honest and saying, yeah, it could have been, because this is experimental, because that's the other thing that they weren't honest about, that they kind of said it as an undertone, like, oh yeah, it's experimental, but you should still get it though. It was kind of that attitude that was being given to us. And then the other things that was happening that my clients didn't like, and still like, they were like incentivizing getting the vaccine, like, hey, come get the vaccine, you'll get a free pizza. And it's insulting to the intelligence of our of our vulnerable population, because a lot of the times the idea is that because we're vulnerable, because we're disenfranchised, we're uneducated. And it's not that under any circumstances. And it becomes insulting to Black men and women when we hear things like that. And that's kind of what I was hearing from my clients. Like another part of them was saying, well, I'll wait till everybody else get it and see if they die. I'm just being real. This is what they were saying. Like, not gonna let, like, no, none of the people I worked with denied that COVID was a thing. So when I interacted with my clients, we wore masks, we did our best. Like, if I can help you over the phone, sis, I'm gonna help you over the phone. Anything we have to do in person, we're gonna make it quick. We're sanitized. I got stuff in my car. We're gonna make sure that we stay safe.
Right.
So I think that's really what was happening among the clients that I was serving.
Okay, thank you so much. And so one of our questions talked about misinformation, and Dr. McManus and Ms. Norton, I want to have you guys chime in a little bit on like the reality that there actually was a lot of misinformation floating around in the early stages of the pandemic. Where were you all able to get your information about COVID to waylay the fears or the concerns, or just to be able to address some of the folks that felt like, I just don't have enough information to make a decision? So Antonia, if you would start.
For us, I mean, because we were the call and push for vaccinations in the Black community to fight against that virus, it caused a number of individuals that for you to hear about the information, because so many individuals, particularly in the Black community, I mean, some of the first deaths were, I believe one was a firefighter that was very close to my brothers, and then a number of other individuals. It got to a point, the first 11 or 15, the number of deaths. But the biggest thing with these voices that we're hearing from our clients and from among others was the number of things that centered on the mistrust due to historical racism being at the core. Such as, for example, some talked about, well, white people are not getting the shots and they angry and they protesting. They did that quite a bit here in surrounding suburbs like Brookville. Those people were angry against it. So you hear other people, Black and brown people in the community, talk about, well, this must be a setup. They pushing it in our community. They not getting it. So it must be a setup so they can, I heard one person say, to kill Black people with one click, or as an experiment for Black people as test subjects, as was conducted in the Tuskegee syphilis experiment on Black men. You heard a lot of people talking about that, just to see what would happen. And so they could develop effective treatments for white people. I heard several individuals talk about how they are, that community doesn't value and treated them with indifference, such as the fear of vaccines being a cover-up for the implantation of microchips or other harmful tracking devices or some other experiment. Because of the Black community's experiences with historical racialized trauma and oppression, there continues to be mistrust with systems, including healthcare. Many experience traumas with medical personnel who have mistreated them due to racism. One individual talked about receiving no effective pain meds after a medical procedure and said the nurse told her, "You people can handle it." And she said, "Besides, you've delivered babies, so you can handle it." This client was really upset because she said she suffered a lot of pain. And she said, even if they pulling back on some pain meds that they profited from, everybody is not an addict. And she said, some people need stronger meds for a time. She said, even Black people. And so that's been some discussion that one older woman talked about a dentist not giving her Novocaine or pain medication or something, and was just drilling in her mouth to fix a cavity. And that individual said something. I know the National Center on Abuse in Later Life has a lot of information where they're working with older adults and getting this information. But there was just so much. And as to what, with Sheila Walsh, when, that you were talking about, talking about the gifts that bleed, and yes, and some gifts can truly make you bleed, and that bleeding gets your attention.
Right.
And
right.
Go ahead.
Sure. Yeah, I appreciate you drawing a connection between the historical mistrust and then this, which wasn't vetted and people were concerned about, and then just how just little conversations turned into conversations that look like fact, and really they're just a perspective. And I think that it's just good for us to continue to make sure that we have really a broad amount of information to just share, so that as people are making their decisions, we allow them to make their decisions. We recognize that they made an informed decision, and we honor the fact that they got to choose whether they got it or not. Working in the healthcare industry, one of the things that we have simply tried to say a lot is that the vaccination isn't going to prevent you from getting COVID. It's simply going to prevent you from getting as sick with COVID as people who are unvaccinated. And, that becomes really difficult to manage when the people that got the vaccination seem to be dying. And I understand that that's one of the things, Crystal, that you talked about. I guess the difficulty in that is us not having all of the information that has the complete story of the circumstances. We know that there are certain conditions and certain populations that had those kind of additional vulnerabilities, and they were at higher risk for problems and all of that stuff. And we won't probably ever know those things, but I think that it's so good that we're having this conversation and we're learning how to make sure that we are giving people the resources that they need to make the decisions that are best for them. And so thank you so much for that. Dr. McManus, if you don't mind, I'm going to go to another question. We got a good set of responses from that one. So I'm going to go ahead and then I'll start with you on the next question. All right. So there was a moment, because of all of the conversation about celebrities and prominent people who were getting the vaccination and dying, there was a moment when the average person realized, oh my goodness, I could die from getting the vaccination or from getting COVID. When was it that you personally realized kind of the seriousness of the pandemic and made a decision about how to support or care for the clients underneath you? Because I think for a lot of people, it became really difficult to keep personal beliefs out of the supportive services. And I wanted to say this because somebody said something that triggered this in me. When we are supporting victims of domestic and sexual violence, we know forever that we've said that they're the expert at their story. Well, whenever we're supporting victims of trauma or members of the African-American community, like, we have some similarities in our experiences, but every individual is the expert at their life, at their family situation, at the decisions that they have to make. So Dr. McManus, would you mind kind of chiming in about how you personally dealt with either what you felt responsible for as it related to vaccination conversations?
Well, I really definitely thought that, and still think that you have to respect the person's where they are when you meet them. You respect if they don't want to get vaccinated. You can't just yell at them and tell them what they need to do. You have to walk through and help them find out why not. And then if they still say no, still respect who they are. As I was listening to you, I was thinking, I was watching TV one day and Dionne Warwick was on one of the channels. I don't know if any of you guys saw that, but it was really interesting because the person which was a black male, I can't think of his name now, but asked her about, have you been vaccinated? And when she said no, he just looked at her almost like she had turned into a different animal or something. My assumption is, because she's Dionne Warwick, they would just assume if she'd get there and say, yes, and let's take, and all that. She said, well, no, I haven't made up my mind yet, and they were almost stunned because I think they had their own discussion around assuming that she already was vaccinated, or at least believed the same thing they did about telling people. And she was like, well, I think she said, I haven't said I'm not going to get it, but I haven't gotten it yet. I haven't gotten the feeling that I need to have to make that kind of decision, And that's kind of what I kind of would like to her, because that's me, I mean, that's how I feel, is that, and if people trust you, invariably they will go with if they ask you, and they trust your opinion, but doesn't mean that moves them automatically to doing something that they still have a real concern about. And I was trying to encourage people, don't then go negative on. You got to respect what they think, just as you want them to respect. And that was part of the coalition one of the objectives of the coalition that I told you earlier that we put together, because then you had, I purposely asked Dr. Alonzo Walker, who had just retired from Frederick Hospital as chief of staff there, to chair that community for us, to chair that, because he's well respected within our community. He's also the kind of person that doesn't believe even the stuff he does as a doctor. Well, this is what I said, so you got to do this, because we do that. You see that too many times, and I think we're too. But then we also had a person of mine who, and I won't give her name, but who just came in one of the meetings. She's a person that has a degree and stuff like that. But I mean, she just kind of went off on. She was telling the group in our thing about how she not treats them, but what she tells her clients. And I mean, she just blasts them if they don't get they haven't gotten they haven't gotten sorry, I just went blank.
Vaccination.
If they hadn't gotten what they needed against COVID, then they I mean, she was almost, I mean, she didn't go out and say they were stupid, but I was very shocked. I didn't expect that from her. So then, of course, I had to have a conversation with her after the meeting, and talk to her about it. And she apologized. She didn't realize, but she was just frantic. She wasn't trying to be mean to people, because she's a very loving person, but you don't want to get the vaccine. But then I think what folks learn is that there's ways to talk to people about those kind of things,
Mhm.
and who knows, they can get it sooner or later. And certainly since that time, I have one of my granddaughters lives with me, and she's I've had her since she was 13. She's 21 now, but I had her since she was 13. And because some of the things that my daughter went through just couldn't handle her, and she had some issues herself. So she with me, but anyway, so I went and got my vaccines, and I'm asking her, because what I would do sometimes is just say, don't we have an appointment for you to get your vaccine? She would look at me like, really, Granny? No, we haven't done, yeah, but I didn't do the yelling, or, I said, well, okay, I thought we did. And she just puts her head down like, Lord have mercy, I gotta look at this woman. And I just think, I say that to say that we really do have to be mindful of how we talk to people, and how we respect, even if you disagree, in terms of respect. Now, as it turned out, she ended up getting COVID and getting long haul COVID. So for a year now, she's got 8 different specialists. She has to take oxygen with her wherever she goes. I mean, that's from a baby. I mean, she's gotten her vaccines now, but that still was something that, whether and I'm not even sure, because certainly between there's CDC. I mean, once we got Trump out of there, I went back to listening to what CDC said, and still had my own mind about what was going on. But that's the CDC, and I like the clinic up in Minnesota that really, they're community based, and I guess that's the point I'm making, is that I find that's what we do as a Black Health Coalition. We work with the communities, find out what they have, what they need. And they really, what we did with that coalition was have people come in and talk to them, and they can ask questions. They could see what they want to say. They make their own decision. Then we had another group, same folks who were on the coalition too. I shouldn't say another group, but we also had them then going out and talking to the community, knocking on doors, and we would give them, either some kind of card or ticket or something like that for doing that. But they didn't mind going, because they learned how they felt about it. They figured they got, decent information. Didn't mean all of them wanted to do it, because they didn't, but the ones that did would feel comfortable going door to door, and no matter what kind of response they got, they knew how to respond. And I think that gets lost sometimes when I talk to a lot of other folks, especially white folks, but a lot of other folks, in terms of how they always want to come in and deal with our community, but they don't have respect. And most of the time, they don't know they don't have respect for our community.
Yeah.
They don't. And so when that happens, if you don't know, and that's what I've spent the last 33 years of working with the coalition, to work with our community, work with the other community too. And even when we say, you asked about our population, obviously the priority is African American, but we serve anybody who comes to us that we can help. We provide services too. We had a person called from way up north when they first started the insurance stuff, because we were one of the places, and so we answered the phone, and my staff friend said Black Health Coalition, and she said, I think the lady doesn't upset you. I got on the phone, I said hello, and she said, so you're the Black Health Coalition? I said, yes, ma'am. And she said, so she was from up north someplace. She said, well, do you serve white people? And I said, yes, ma'am. We serve anybody who needs help. I tell you, that woman went and recruited more people from up north
That's a
for us
great,
to work with.
that's a great
You know what
story.
I'm saying? And
Yeah.
she just felt comfortable then, when she would
Uh-huh.
call. By that time, we would call her name. And I'm just saying, there's times when I think people think because folks have degrees or something or are health professionals that they'd be the best. No, they can be the worst in terms of interfacing with people. And so I try certainly to try to get people to kind of understand that dynamic. And we work
Yeah.
with, but we work with people no matter who they are. And I think we've done well, but I think we have a good reputation, I think, within the community.
That's excellent. Thank you so much for your
Mhm.
service, and thank you for that story. Antonio Gramsci, he was a philosopher and dabbled with sociology, but he said something in some of his research, and he talked about organic intellectuals. And basically his position was that experience makes you an intellectual. The experience of it makes you kind of the expert, et cetera, et cetera. So very similar to what I was saying about victims being the experts at their stories.
Right.
Well, so when we have talked about COVID, you guys, several of you have talked about something that raises this idea of accountability. So we are supportive service providers. Some of the name of our organizations has a focus or intention to make sure we're caring for Black, Brown, and other marginalized populations. I'm curious about this idea of accountability sometimes looking like either this or that and not both and. Because what I just heard you say, Dr. McManus, is that you guys understood that you were both serving African Americans and anybody else that called your clinic and needed help, right?
Exactly.
And I think that when we looked at this whole thing about celebrities or medical professionals or just people that had certain status in the community, that the message that was being sent was either you're correct by getting the vaccination or you are not smart enough, not informed, and doing harm. So in that is this accountability. And so I want to just spend maybe 10 of our last 16 minutes talking a little bit about who is accountable as supportive services. Where does our accountability lie or lay?
I'll jump in. So that was sort of my response to the question regarding Sheila Walsh and some of the gifts. So one of the things that I think was a gift and a takeaway for us was that it brought an awareness, not just to healthcare systems and healthcare providers and medical providers. It also brought an awareness to our community, right? An overall awareness of we are not in good health. We are not taking good care of ourselves. It was undeniable, as horrible as it was and as hard hit as the people of color communities were, it still began to echo. And it was like a yellow highlighter was just put on everything. Like, we're not doing this. We're not doing this. We're not doing this. We can't point the finger on everything. And so now in my age group and younger, and even, the generation before me, I'm hearing more conversations about the personal accountability to how we're going to get better as a community. There's more individuals that want to work out now and exercise. I am one of them, right? There are more individuals like the jump rope challenge that became a part of the pandemic. Like, that's something I'll always take away from the pandemic as one of the gifts. We were jumping rope with people around the nation. We were concerned about our our health. We were concerned about what we were eating. We were concerned about, okay, some people still had the mask debates, but there were more who were wearing masks who were not. Sanitation became a concern, things that we weren't thinking about as much. So I believe that one of the gifts was that it was highlighted, but if we look at it from a different perspective, it was highlighted so that we can now take more accountability, and we were able to then teach our clients a better way of advocacy.
Yeah. Wow.
That's another form of accountability, is you have to go and advocate. And this is what healthy advocacy looks like.
Yeah. Wow. That's great. Crystal, you were going to jump in?
Yes, because I agree 100%. I would say there's accountability that we have to have personally. I mean, because if we get COVID, we suffer from the effects of it. It's personally on us, but there is some accountability that the healthcare field and the government of America that's promoting this has to take as well. I agree that it really shined the light that we are not healthy. Those who already had diabetes, those who were suffering with hypertension were the hardest hit. And it really shined a light that these health conditions we really need to treat. And it starts with the individual. So one thing that I started personally doing, even though I don't have any of those issues, one thing I personally started doing was I started eating far better than I was. I cut out so much sugar. I added a huge vitamin regimen to my body to ensure that, my immune system was supported. And if anyone, like I said, I'm not a healthcare provider, so I'm not, I don't like just tell my clients like, here, do this,
Right.
I'm very careful of that. But it is something that I think should be made available to those who are looking to support their health and their immune system. Now, as far as the accountability that healthcare providers have to take, it's undeniable that, and I'll just speak for Black women in particular, because that's the majority of the clientele that I serve, that
Mhm.
Black women have been sorely mistreated
Yeah,
by the
that's an
healthcare
understatement.
system. And like you said, your experience makes you an expert,
Mhm.
I'm sorry if I Renita, if I misquoted that or I didn't say it
Oh, no,
exactly.
you good. Yep.
But
The organic intellectual. Yep. Mhm.
yes, so a lot of us have directly experienced medical abuse. And I can, like, me personally, as a person who knows how to advocate for myself, who knows how to take care of myself, I recently, actually this year, experienced a very life-threatening medical abuse that I almost lost my life in a hospital because they did not believe me when I said I was experiencing what I was experiencing.
Mhm.
Like I literally almost
That part of racism has been there a long time.
So
Yeah.
yes, so we have to, so healthcare providers, it is essential that if you're in this field, you have to take accountability for for not necessarily, you may not have personally done anything, but maybe you have and aren't fully aware. But that's why it's so important to become educated in what the Black experience is, because of the historical trauma that we've encountered, the historical racism, the historical abuse in medical systems.
Yeah.
It has to be, yes, this is what we
But
experience.
also, it's not just historical, it's still there.
It's current. Yeah, it's
Exactly.
happening right now. That's what I'm saying. Like I just experienced it myself. And
Mhm.
so it's like the peak gaslighting to say, no, that these things aren't actually happening. Take
Happening,
the
yeah.
vaccine.
Yeah,
Like,
yeah,
no,
yeah.
we have to acknowledge and say, yeah, we could do a whole lot better.
Right.
And just with the restoration of like the justice, because we want to feel like we're being served justice, like nobody's mistreating us, nobody's abusing
Right.
us. And when we feel like we're not receiving that, you're not going to get the cooperation you think you should get. And I also think that I love this meeting because I think that we do have to respect people who have made what, even if we don't agree with their decision,
Right.
respect what they say, because maybe they'll change their mind later, but maybe they won't, and be okay with that.
Yeah.
Because as soon as we feel disrespected or like our intelligence is insulted now, now all that trauma that we've been suffering, all of the racism that we've
Activated, sure.
experienced, it's like,
Sure.
see, this is why I don't trust y'all.
Yeah,
Because of how you treated me when I said no.
yeah.
So
That's
it
a
just,
really
it
great
just
point,
adds to it.
Crystal. Yeah, that's a
You know,
great,
and even back, I was going to say, mentioning that too, is that even remember, I heard somebody say something about Tuskegee. But what people haven't, I've raised it, and people are like, oh, I didn't think about that, is that because that, like, you have your population, their population was black males, but they did nothing to those black males, wives, and children who were coming in contact with them with the
mhm,
syphilis. Do you see what I'm saying? I mean, and that
yeah,
never, it's never even been written up. It's just
yeah,
like they never existed, because it was
yeah,
just the black males.
yeah.
That was the problem. And you still see that now, I'm telling you, in some ways, in terms of how people wrap around what they, especially when they come in our community and want to do something, they just make the assumption that we don't know about it because you wouldn't
Right.
need them, or you can't do it. Very different in how they still relate to us. But what we learn, we grow in terms of respecting people who, whatever kind of medical piece they are, or whatever kind of education they have.
Right, right,
We've always, we speak to, those are not only our elders, but people that we respect because they made it to get this done.
right.
But what they don't see sometimes is maybe you need to learn beyond what they teach you.
Yes, yes,
And that
yes,
is looking
yeah.
at how is the community doing things, and don't just dismiss it because it wasn't in what you studied when you went to school.
Yeah, yeah, I love just this train of conversation. I mean, because you all are highlighting the reality that we have to we have to accept that there's implicit bias that's still affecting people of color when they
Yes, it
go
is.
they are getting health care, when they're seeking health care, and it's affecting the outcomes. That's why we do the health disparity prevention at Prevea. I think the
Mhm.
other piece that you just highlighted, Dr. McManus, is that the African American community, culturally, when we see ourselves, we see ourselves as a part of a more dynamic whole rather than more individual, right? And so when
Mhm.
you're talking about one person, we're talking and thinking about how whether I get a vaccination affects my auntie and
There
my
you go.
grandma and my little
Mhm.
children that are going to be visiting, and all of these other things.
Yes.
We've heard so many different stories of one person getting the COVID virus and the whole families, 4 or 5 people dying as a
Right.
result of that. And so, and we know that because that's a conversation about resources and access and all of these other things, that this conversation is different when you're talking about African Americans
Yeah.
than you're talking about folks that have better resources or whatever. And I just think that it's important for us to be just cognizant of just the different needs of individuals in the African American community. And that it really is begging a question of how culturally responsive care providers, supportive services, the government, et cetera, are being.
That's right.
So we have 6 minutes left, and I have one more question that I want to make sure to ask, and then I'll let us kind of just talk and talk our time out. And so the question is, what one thing do each of you wish more government and health officials knew about the communities that you serve as it relates to vaccination? What's one thing that you wish the government and health officials knew about the population that you serve?
I know I can add something. For one, I think that is overarching is the fact that culturally responsive programs that are developed by and for groups of communities of color are valuable assets in the community and worthy of significant partnership. And for one, because they need help. So you have mainstream providers that are the ones that are recognized, highlighted in the media, have access to the social capital that is needed to be able to do this work and are not seen as valuable. So that's significant because if we have the resources and supports to better assure equity
Mhm.
Oh, yeah, that word gets thrown around so much, it makes me sick.
You know what? I'm so sick of it because you'll see where you have your programs are there, similar to, we are here, MKE .org, for example, is the collective of the culturally specific programs in Milwaukee, and it's 7 of them that provide domestic violence and intimate partner violence. And the reality is that utilizing and supporting and elevating these programs would be because they're serving a population that is not reachable for many of the individuals in their community. They're not coming outside their community. So, being responsive to the resources and supports that communities of color trust,
Right.
to be able to better assure that they're able to be there and continue and consider the partnerships directly with these individuals. So our responsibilities and roles are significantly challenged, and due to the lack of access to resources and supports within the community. So that's one thing I would like them to know. Those programs are there. Those community, you have to go as close to the source impacted to be able to help and find ways that you're going to develop solutions. And it's valuing the voices of that community and doing so in a way that is usable, because sometimes representation is important.
Right.
Representation on all levels is significantly important. And one of the things, with campaigns, it's like one of those gifts that she was talking about earlier, having, consciousness, and I know Crystal and Dr. McManus said that is by recognizing the magnitude and depth of poverty, oppression, and need in the lives of Black survivors and these families, that she's at the bottom of the social rung, and how navigating a global pandemic can be so devastating to lives, families, and communities. And I think another gift is for us has been preparedness and the need to intentionally reimagine and reshape how we work with survivors and their families that continues to develop, and being able to do it in safer ways that protect each from the spread of not just the COVID. You've got all these variants. And as a matter of fact, I know their variants are continuing, but you're not hearing a lot about it, and developing and designing messaging, culturally responsive campaigns and information using authentic, credible messengers, because representation, and along with what we've had to do is the expanded.
Up, you went off your voice. It sounds like we lost Miss Van. Okay.
There's.
Oh, did I?
Yep, you went out.
I'm sorry. I just see this little box that says unstable internet. I have no idea what is going on with Spectrum, but they're saying something about a satellite. What'd you say?
So we did hear the last comment though, and so just in the interest of time, I want to shift and get one more person in to respond to the question of what is one thing you wish the government and health officials knew about the population you serve as it relates to vaccinations. So one other person, please, while we are closing up.
I'll say it really quickly. I've said it before. I've said it before on a platform with Prevea Health. It was just mentioned about equity, right? And I'll say it again, there's a difference between equity and inclusion. So what I would love for there to be, for it to be understood is that you can give us, make these resources available. You can make the funding available. But like it was mentioned, you need to include us though. Include us in the conversation. Invite us to the table. And when we get to the table, our meals need to look the same. What's on your plate should also be on my plate. And how do you know what it is that, I would prefer on my plate is have a conversation with me. Come into our community. And these forums, these platforms is very helpful in doing so. We need to have a conversation because after you look at your data, we're still real people.
Right.
After you look at your data, we're still humans, right? We're still
If
humans.
we ever were, you're
And-
saying that they don't think we are yet. It doesn't come out.
Mhm,
It's
mhm.
deep inside how they operate. I mean, you can have the nicest people, but they don't realize that they still see us running through the jungles. You know, but they wouldn't think of that. I offer it to them. I'm in trouble. I stay in trouble. But
So just to sum it up for me,
just to
it is-
raise it, right?
is
That they
to
need to
put
know. Yeah,
equity and inclusion together. Include us in the conversations, and let's make sure that what's available is the same across the board.
Okay, excellent, very great. This is what the people need. Is
well, the
act-
same, but it also includes exactly what we need. We're different.
Yeah,
I just want to make sure we don't necessarily get the same what they have. We may not need exactly, but the same. We need to have the same facts in terms of making sure that whatever we offer, that population, because they know what they need. We work with a different
Right.
population. We don't know. We work with a Hispanic population like that.
yeah,
And I thought I was good, because I put everything together. They got everything else we all got. And then the little lady pulled me aside. Dr. McManus, she's telling me how that they felt they were lost because I was giving them. I thought we were helping them being fair because we gave them what we gave us.
right.
The lesson I learned was that because they got their own, and then of course the black folks looked around and said, "Y'all know who y'all sound like, don't you?" Because then when we switched and gave them the freedom to let them do, so I'm saying I don't want to lose that because that was a lesson I learned, and I think it's important that we do still understand that,
The difference between equity and equality, absolutely. That
Yep.
equitable is that everybody has what they need. So we need to make sure everybody has what they need, and it may not be the same. And so
Right, yep.
thank you. Ladies, this has been quite enjoyable. And you know what? Time flies when you're having fun. And so I am going to just appreciate you by saying thank you for your service. Thank you for the work that you do and by extension, the work that you are healing Wisconsin with, because I do think that these conversations are healing conversations. I think they give people permission to do better, to go back and do some of the things over that they didn't get right the first time.